The best thing about being a pharmacist is the level of impact that you can have on a patient's care. It is quite tough to get here, but once you're here, it is a really worthwhile career choice. You've got quite a few different options available to you. You can either go into community pharmacy, so you might choose to work at a Lloyd's or a Boots or an independent pharmacy, or you might choose to come to work at a hospital, where you'll spend a lot of your time on wards. Or there's also GP practice pharmacy, so there's a lot of new roles at the moment where pharmacists are working alongside GPs and practice nurses as well. I'm one of the pharmacists at York Hospital. That means that I spend most of my mornings on the wards reviewing patient drug charts, making sure that the medication that they've been prescribed is safe. In the afternoons, I focus my attention on my specialist area, which is electronic prescribing and medicines administration. A hospital pharmacy is made up of several different departments. There's a dispensary, where medication supplies are made. There's a medicines information department that receives questions from doctors and nurses and other pharmacists and patients even. There's an aseptics department where we make up intravenous drugs, usually for patients that have serious conditions such as cancer. A good pharmacist would probably have quite high attention to detail. You need to be able to pick up on the smallest of things. You also need to be able to build relationships with people. It makes your life a lot easier when you're suggesting a change and you're able to have a discussion about the patient and the patient's needs. Science is quite important within pharmacy because you need to have a good understanding of how the body works, and then how drugs might affect the body, and if the patient has sort of problems with their liver, or if they're a low weight, then you're going to need to know how that's going to affect the way that the drug works with that patient. So I would say it's quite sciencey, particularly biology and chemistry. In order to become a pharmacist, you have to do your A levels. Preferably, different universities have different requirements, but most new universities, I think, still ask for 3 A levels, preferably with 1 or 2 science-based subjects, and then you go on to do a master's degree in pharmacy, and it's all incorporated into a 4-year course. And then after that, you have to do a pre-registration year, and then once the pre-registration year has finished, you do an exam, and that allows you to start practicing as a pharmacist once you're on the register of pharmacists. One of the best things about the job is that you can leave each evening knowing that you've made a real difference. So for example, you might have picked up on the fact that a patient requires a smaller dose of a blood thinning medication because their kidneys aren't working so great, and a pharmacist's input allows the patient to avoid serious side effects such as bleeding in the tummy or even the brain. So yeah, the job satisfaction it's really quite high, especially when you've made an intervention like that, and those interventions are like you get to make those quite frequently.